Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. You know, our show is dedicated to giving you answers that are safe, healthy, and effective for many different medical problems out of the traditional conventional. Uh, I have a new sponsor who is actually an old sponsor that has come back now that we are established here on YouTube. We used to be doing this show on another station for a while, and that is PromoLife. PromoLife at promolife.com makes medical ozone generators for people to use for home care as well as for doctors to use. And they also have a complete line of ozonated oils, organic ozonated glycerin. All their products, by the way, all their oils, everything are organic and made ultra pure. And they're exceptional. If you go to promolife.com, promolife.com, you can look at all their different products. When you're ready, however, I recommend that you call them. If you call them and tell them that you heard about them here on Dr. Robbins' show, they usually will do something special for you. They'll give you a percentage off. Their phone number is 888 742 3404. That's 888 742 3404. Tell them you heard about them here on my show, and that they're going to do something special for you. Today's show is on, and I thought I had done it already, something that I get to see way too often, human papillomavirus, HPV. HPV, as it's commonly called, is just short for human papillomavirus, and it's a very commonly sexually transmitted infection. Although, while most people believe that it has to be transmitted sexually, it does not. You can transmit it by coming in contact with the virus and then touching yourself down below. So it is possible to get it without sexual transmission, even though that's the way traditional medicine says is the only way to get it. They're wrong, okay? They like to tell you that, the only way to avoid getting it, because if you're sexually active, different statistics come out and said half the people that are sexually active are going to get it. It's possible. It's possible. Mostly because a lot of people don't know they have it. So they transmit it without realizing that they have it. If they knew they had it, they can do something about it. So let's talk about the details around it and then how we get rid of it. Well, first of all, women get it, and they get it generally internally, vaginally, that is, and they don't realize that they have it that they have it in there. They may be having intimacy with a man, and they feel that it's just a little raw or sensitive today. Maybe they're not producing lubricants fast enough. And then as they do, it eases up, and sometimes it's just an uncomfortable experience, or sometimes they won't even realize that this really occurred. Often they discover it when they go to their OB/GYN and their gynecologist does an examination and a pap smear. But keep in mind that it is absolutely impossible for a gynecologist to examine a woman every square millimeter internally, and it's just as impossible for them to scrape as they need to for a pap smear every square millimeter of a woman internally. So it can often go undiagnosed, and where they think they were clean because they went for an exam and they're fine, maybe they're not. You can also get it externally, okay, anywhere really, and orally as well. Now, orally, it can be transmitted in various ways. Most people think it has to be transmitted through oral sex, and it probably is transmitted predominantly through oral sex. But If you've come in contact with the virus externally, somebody, in a bathroom, men's room, women's room, has touched themselves and doesn't realize it, they can actually attach the virus to various things. If you don't wash your hands carefully after you exit and you touch yourself down below, or you may put something to your mouth, then you can transmit it in there. HPV cancer is very common and it's pretty serious. The claim is that 85 to 90% can be treated successfully. It's a very difficult infection to completely eradicate when it's, cancer to eradicate. Very serious. So let's go into talking about how to get rid of it. First, prevention. Be careful, only have protected sex. There are things that I won't say on the internet that I will say privately to my patients in how to observe and watch for signs that something may be in a new partner or even in a partner that you've been with for a while, because you can't necessarily trust people these days, maybe any days. So there is this risk for transmission, and people don't want to think that, oh, I messed around with somebody else and I caught something and now I'm going to give it to you. They'll often look to hide that kind of thing. They may not realize it. Men scratch down below. Now, with men, it's all external. But men scratch all the time, and if it's irritated and itchy and they scratch themselves, that's not unusual. And it could be mistaken for an infected hair follicle, either in a woman or in a man when it's external. When it's on the penis, then it's pretty clear to see something unusual is there. It's round. I mean, you can look this up on the internet. You can go and look at pictures of it on Google Images for HPV so you can get an idea. And you can find it in many different places. There's over 150 types of HPV virus, and only about 40% of those, according to the research that I did, are actually sexually transmitted. It can be around the anus, the mouth, the throat. I mean, in the mouth, it's kind of, pretty serious because, it's a wart virus. And warts, like the wart on a witch's nose grows into a large lump. Well, that's a pretty serious thing. If it gets into your throat and starts blocking up your passage, you may not be able to swallow. And that may be one of the first signs that something is going on when it's in your mouth. So kind of serious. Obviously, there are ways to keep yourself from getting these things or killing it off as soon as you do get it by keeping a strong immune system. Vitamin A, vitamin D, vitamin E, all the antioxidants, vitamin C 5 or 6 times a day. People have asked me, why don't you give exact amounts that you want people to take? Reason I haven't offered exact amounts most of the time is because it varies from person to person based on body size, what might be an optimum dosage to take. It also becomes very complicated, and I probably have to do a whole bunch of shows just on each and every vitamin and mineral supplement, because depending on sources, quality of the product, you're going to absorb varying amounts. Obviously, you have to have a good digestive system, a healthy digestive system. That's where Doctor's Biome, that probiotic beverage you heard, and I've done many shows on probiotics that you're going to hear about, one of the other sponsors of my show. Doctor's Biome, available at doctorsbiome.com, doctorsbiome.com. And you drink 1 2-ounce shot every single day if you don't have HPV in terms of preventing it. It's a very delicious probiotic beverage, 15 patented strains in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's delicious. You take the food supplement version, in terms of prevention. If you get HPV, then you want to get the medical food version. Don't worry about what the label says, which medical food version it is. You can get the Doctor's Biome Gut Health for C. diff, CD, whatever they have on there. It doesn't really matter. It's the same product. It has 15 patented strains created to survive the stomach over 90% and stick to the wall of your gut. That's why it's called a smart probiotic also. And that boosts the T cell system in your body by getting yeast in balance again. And by doing that, you can fight virus, fungus, yeast, and mold better. Now, at the same time, it helps repair the digestive system so you can absorb all these wonderful, expensive nutrients that you're taking. Vitamins, minerals, herbs will all now be absorbed optimally into your body so they can do good. And that's why I can't just give you a set amount. If you don't have a healthy gut, you need more. And if you do have a healthy gut, you could probably do with less of all these various vitamins and immune boosters. But once you do get it, the only thing that's going to get rid of it is intravenous ozone. Now let's talk about that. And the way I give that is, let me give you the Jessica story. I'm not going to say who Jessica was, but when she was 20 years old, she came down with HPV from sexual contact with a man. And when she came to me, I said, well, you're going to need to do intravenous ozone in the direct IV method, because only where we push the gas, and you can listen to my podcast called Intravenous Ozone, Everything You Need to Know, where I go over all the different methods. And the Robbins method, my version, RMDIV, of direct intravenous ozone, where we push the gas directly in, which I've done over 375,000 times as of the date this was recording, has been shown to be the most effective way of getting rid of any virus whatsoever. So when you need to do this at least 3 times a week. That is the bare minimum. Some people think they can buy with 1 or 2. It's just not enough medicine. Normally, you take medicine for a medical problem every day, usually 2, 3, 4 times a day, let alone just once or twice in a week. So the minimum of just 3 treatments a week is proven extremely effective against this, while more is better. If you came more frequently to get direct IV ozone, you would get rid of it much more promptly. And ask the doctors that I've trained to treat this, and they'll tell you that. If you can buy a PromoLife home care machine and do what's called vaginal insufflation, which is an ozone douche. You want to wet your vaginal walls first with, sterile waters, and then you can push the gas in. I've done shows on home care. It explains it. PromoLife explains how to do it as well. If you can't afford to buy a home care system, you can buy, they do have suppositories. And you can buy their ozonated oil suppositories. You refrigerate them so they're hard, and then when you push them in as far back as they can go. They're done once an evening. You can use a light panty liner to prevent leakage. For a man, you can bag your penis. They do sell bags if you want to buy a home care system. Otherwise, you can put organic ozonated hemp oil onto it to attack it topically from the outside in. Don't want to be injecting. Doctors shouldn't really find it necessary to inject internally in a woman or even externally in a man to get rid of it. Just the intravenous ozone does the job. Now, when Jessica came in, she did it only twice a week for 2 weeks with vaginal insufflation each time. Went back to her doctor. It was completely gone. He was wrong. She goes, Dr. Robbins, it's completely gone. I said, no, it's not. It's in the deep tissues. So while it may look gone superficially, it may still be there, and likely is. You need to do this for about 9 months. It's an average, probably less for many, but I don't want it to ever come back again. So I always recommend 9 months of care. It was gone. She stopped coming. 2 years, about a year and a half later, I got a call to tell me it came back again, and that because she knew me and she just wanted to give me a heads up, she's going to go for the this ablation, a little minor surgical procedure that they can do as an outpatient, and hopefully that'll get rid of it. I said, well, I wish you the best of luck. If it doesn't work, she's going to come in and get treated again. Well, apparently it worked well enough for about another year and a half or almost 2 years. Then she called me up very upset, very worried, very frightened, because now it had come back with a vengeance. And the doctor was very concerned because it looked precancerous. With that in mind, she started to do the therapy, the minimum of 3 times a week. She got a home care ozone machine and did vaginal insufflation, each day, each evening. 2 weeks later, she went back to her gynecologist. It's completely gone. He can't believe it. It's a miracle. He's never seen anything like it. This is just unbelievable to him. And I told her, Jessica, listen to me. It is not gone. You need to be doing this for the 9 months that I said if you're only going to do it 3 times a week. Well, she continued to do the vaginal insufflation. At that time, there weren't those suppositories available. And ultimately, that was many, many, many years ago. I saw her just recently for a completely different medical problem, and apparently it never came back. So it obviously that was the answer and that it worked, which has been the experience that most of the doctors that I've trained and most of the people that I've seen that have had this have told me. Don't dawdle in getting rid of this problem and be consistent with care. If you do this, I expect that you're going to win. According to the CDC, they'll tell you that 9 out of 10 HPV infections are going to go away all by themselves within 2 years. So if you're willing to risk yourself and your health, refrain from sexual intercourse for a couple of years, hopefully it will go away, it won't get any worse, fine. You're going to have to be very careful, because if you're touching yourself, wiping yourself down in your genital area for any reason, and your hands get near your mouth, you could wind up transferring the virus orally. And now you got a real serious problem, in my opinion. Statistics shows that 70% of cervical cancer cases come from HPV type 16 and 18 in particular. Though type 6 and type 11 will show in the form of warts, I believe any of these types can cause the problem. And like I said, very, very serious. The key is prevention. So safe sex is the best way to go. Using latex condoms orally. I don't know how you can prevent, and if you're going to, how you can protect yourself orally except by refraining. Know who you're with. There's more that I would tell in terms of prevention, in terms of intimacy, if a person is a patient of mine. But here on the internet, I try to keep it a little bit more less personal, a little more generic, and there are certain things that I think people might get weirded out by if I said them, so I have to be careful. But if I get calls or emails and then we can speak about things, I'm always happy to help people out. You could reach me in my Manhattan office, through my Manhattan office, at 212-581-0101. That's 212-581-0101. You can email me at Ozone Doctor, OZONEDOCTOR at yahoo.com, YAHOO, Ozone Doctor at yahoo.com. Subscribe. I'm supposed to tell that also at the beginning and maybe the end for sure. Please subscribe to my channel and tell your friends about it. You have to go through all our shows, and by going through all our shows, and we have quite a few, if you go to Functional Medicine with Dr. Robbins. Maybe you just found this one separately elsewhere on YouTube, and you type that in search and then click on a picture of me and the name of the show next to it. It takes you to my channel. Once you're on my channel, you'll know you're there. You'll see the picture in the name, and underneath my name is the word videos, and you click on that, and name of the, and when you click on that, you get all the podcasts. There's quite a few now, and we're adding on more and more every month. Everybody, thank you. Stay safe, stay healthy, stay well, and tell your friends all about our show. Bye now.